Hi everyone, I'm Sam Finch and this is my family health promotion project. As nurses, it's important to switch from individual focused care to family focused care. Thinking family is an attitude that can be applied in nursing practice to help improve how patients and their families are cared for and to overall improve outcomes. The purpose of this family health promotion project was to effectively demonstrate the use of a holistic assessment, formulate a nursing diagnosis, develop an action plan for health promotion, implement the plan, and evaluate the progress towards the goal. The family assessment was guided by a theoretical framework developed by Sharon Denham, referred to as the family health model. Methods used to collect information included family observation, in-person interviews, family assessment tools such as the genogram and ecomap, along with assessment of the core family processes. As we have learned this semester, the family health model is helpful when looking at the family unit through an ecological perspective, which examines factors that influence health. By using this model, nurses are able to assess the interdependent relationships of households and identify needs within the family unit. This model helps others understand what motivates the family unit and what they value in their lives by examining the three domains, which are context, function, and structure. As we learn, there are many things that can influence family health. In the contextual domain, this focuses on the connected experience that are shared over time. As we know, families are part of complex systems, and health can be influenced by genetics, religion, culture, tradition, history, and behaviors that are learned and shared among families. The functional domain explains the interactive processes between the family members that occur over time. This can include interaction with one another of the family unit, but also outside of the household. This domain helps explain roles, processes, and behavioral interactions. The structural domain focuses on the patterns of behaviors, which include habits or routines of the family. Patterns are developed over time through interactions with the household and environment. Family routines can influence the potential for health risk. For example, poor nutrition or lack of exercise can lead to health issues. By assessing the individual and family behaviors, nurses are able to set goals that are pertinent to each unique family and evaluate the progress towards each goal. The family health model describes 7 core family processes or ways that families interact with each other, and they help provide a way that health professionals can approach families to implement change. The 7 core processes are cathesis, communication, caregiving, celebration, change, connectedness, and coordination. These areas were utilized to assess strengths within the family, address health concerns, minimize health risks, and maximize health potentials. So the family for my project consists of JH, a 36-year-old male who is married to SH, a 29-year-old female. They've been married for about 9 months, but have been together for 6 years. They have a 4-year-old lab mix. JH graduated from high school and attended a technical college where he graduated with a degree in carpentry. He has been employed as a farmhand for the past 10 years. He has been diagnosed with depression, high cholesterol, and high blood pressure, which are managed with medication. In his spare time, he enjoys spending time with friends and family and collecting John Deere models. SH graduated from high school and has a college degree in elementary education. She has been a preschool teacher for 7 years and is currently employed at a local Catholic elementary school. She has been diagnosed with high blood pressure and polycystic ovary syndrome and is taking medication for her high blood pressure. In her spare time, she enjoys riding horse, spending time with friends, gardening, and going to the lake. The family was assessed on 3 different occasions for approximately 2 hours each visit. These visits occurred in their home. During the initial visit, a family health history was collected. A genogram and ecomap were constructed with the family. The second visit was when the 3 domains and the 7 core processes were assessed. The third visit was when we established a health goal and interventions to help meet the goal. The assessment tool that I used was adopted from our textbook. The process of data collection included direct observation, interviews, use of assessment tools including the genogram and ecomap. Alright, so this genogram is the visual representation of the family's health history. This tool has proved to be helpful in promoting family health as genetic conditions, familial conditions, and psychosocial patterns can be visually examined. So, some of the findings were a high prevalence of diabetes, heart disease, and depression on both sides of the family. Family genograms can help both nurses and families to see and think systematically about families and the impact of the health event on the family's structure, function, and process. An ecomap is another visual aid that is helpful when viewing the relationships of the family along with the environment and community that they interact with. It is helpful in promoting family health by choosing interventions that can increase connectedness, that are supported by their social support networks, and by choosing interventions that are of interest to them. Some of the assessment findings for their ecomap include identifying that JH's work has become a stressor as he works long hours and he has to drive for his job. Church is also a stressor as JH and SH are of different religions. But one thing that was identified in their ecomap is that they have great family support on both extended sides of their families. The analysis of the family story will be discussed within the next few slides. This slide pertains to the contextual domain of the family health model. The family is identified as white, non-Hispanic. They belong to the middle class, and they both have insurance through their place of employment. The family health history showed several health trends. On SH's side, there was heart disease, high blood pressure, diabetes, and hyperthyroidism. On JH's side, heart disease, high blood pressure, depression, and diabetes were present. This slide pertains to the functional domain of the family health model. I was able to gain insight into the family function and dynamics by constructing an ecomap with the family. Extended family plays a major role for this family. Friends are also significant in their lives as they enjoy hanging out with other married couples. We learned that JH's job is stressful and puts strain on family dynamics. Another thing that is stressful is JH not attending church regularly with SH. For the structural domain of the family health model, family health routines were assessed, which focused on nutrition and dietary routines. Due to the risk of diabetes and high blood pressure, it is important to consider the family's diet to determine if there are modifiable risk factors present. JH often relies on gas station food or easy-to-go snacks per week at work. Some examples include 2 to 3 Dr. Peppers a day, vanilla wafers, strawberry Pop-Tarts, bags of chips, Oreos, gas station pizza, or leftovers. SH expressed concern over both of their nutritional intake and risk for developing diabetes. They stated that this was the main area of focus for the health promotion project to help promote a healthier lifestyle. When identifying the strengths and weaknesses of this family using the core family processes, we learned that their strengths are celebration and coordination. One area of improvement that was identified through the assessment was communication. JH is pretty passive and he's pretty quiet, and they both identified that they'd want to work on communication in the future. The specific focus area for this family was nutrition, so the priority nursing diagnosis that was developed was readiness for enhanced nutrition, related to family risk factors of heart disease, high blood pressure, and diabetes, as evidenced by an expressed desire to improve nutritional intake and make healthier choices to reduce the risk of developing diseases. When I asked the couple why they were so interested in improving their nutrition, some of their responses included, so I can live longer, so I don't have to take insulin, to prepare my body for pregnancy, and not to be dependent on medication. The Family Action Plan. The overall goal for this family is to design dietary modifications to meet both individuals' long-term goals of health using principles of variety, balance, and moderation. The goal is that the family will eat more meals at home and commit to weekly meal planning. Some interventions that will be used to help meet this goal include Fridays will be reserved for meal planning. SH will communicate to JH about the meals planned for the week. SH will grocery shop on Friday afternoons after school. Sundays will be prep days, which includes marinating meats, taking out meat out of the freezer, cutting up veggies, prepping lunch containers, and making homemade granola bars. The couple is open to using an application on their phone called Noom. This app tracks what is ate, the portions, and whether the food is healthy or unhealthy by placing it into a red, yellow, or green categories. Some priority learning needs identified by the couple include learning the recommended serving sizes and working on portion control. This slide just shares some supportive evidence to help back up the interventions that were chosen for this project. These are the roles and responsibilities for the nurse and also the family. Just take a peek at the family roles. I mentioned them on a previous slide, but one key one is that they'll encourage and support each other on this new nutritional journey. It's important to remember that no one is perfect, but they're working on making small changes to help promote a healthier lifestyle. The time frame for this project was November 1st through the 22nd, which was a 3-week period. At the end of the 3-week period, a completion meeting was held on the 22nd, which examined the family's reactions towards the health promotion project and their progress. The genogram and ecomap were used as visual aids to show the traits that can be passed along and how family connections can influence health. They were also very useful when identifying the specific nursing diagnosis and interventions specific to this family. The evaluation of this project took place on the 22nd, and that was when the reflection from JH and SH was shared with me, and that it was very positive. They shared that they had not eaten out during the last 3 weeks, which was huge. Meal planning has been going well for them, and SH said that she thoroughly enjoys Walmart pickup for groceries. It helps eliminate some of the temptation, when you're grocery shopping and you throw stuff in your cart on an impulse buy. So it helped them that way with saving money and choosing healthier choices because everything was planned out in advance and she could just add it to the Walmart grocery app for pickup. Some obstacles that were faced included JH's job, as his schedule varied. During harvest, he would get up early and work really late, so like his supper, he would maybe eat when he would get home versus when SH would normally eat, 5 or 6 o'clock. They also shared that they would get too busy to enter their food into their app on the phone called Noom. So in the future, I suggested maybe if they wanted to do like a pen and paper food diary. The solution to the work obstacle is that harvest is finished and over. They plan to continue meal planning in hopes of incorporating healthier choices and decreasing their risk of developing diseases. Some of the other things that they wanted to do was to decrease their sugar intake along with their caffeine. They want to eat more vegetables and fruits, and they also want to choose some whole grain options. So those are some things that we talked about that they can incorporate when choosing meals and meal planning. In reflecting on this project, I felt that the family health model was appropriate and useful. The three domains allowed for thorough examination of the family history, family dynamics, and I was able to gain valuable information for the project. During the meeting times, I utilized therapeutic communication and was confident and comfortable as an interviewer, collaborator, and educator. I am by no means a nutritional expert, but rather I worked alongside the family to help them accomplish their goal by providing them with resources and information. Overall, my interventions were appropriate for the family's level of health literacy and life circumstances. I learned that helping a family make simple steps towards a healthier lifestyle is appreciated and valued. If I had to change something about the project, I would focus on helping the family find balanced meals that meet other goals that they wish to accomplish, such as a decreased sugar intake, decreased caffeine, implementing more fruits and vegetables into their diet, or choosing whole grains. The purpose of this project was to effectively demonstrate a health promotion project by using a holistic family approach. I feel like this was accomplished through weekly meal planning for this family. By using the family health model, I was able to assess the interdependent relationships of the household and identify needs within the family. The genogram and ecomap allowed for examination of factors that can influence health and were used to understand the family. By working with the family, I was able to assist them in developing a goal and interventions that were unique and specific to them. As nurses, we can empower families to improve outcomes by providing family-focused care, and we should make it a priority to shift nursing from individual-focused care to family-focused care. Thanks for viewing my presentation. This is the assessment tool that was adopted from our textbook for the purpose of this assignment. Here are a few more questions for each domain that I utilized for the assessment tool.